Eye movement desensitization and reprocessing for first episode psychosis. What is EMDR? Eye movement desensitization and reprocessing therapy was developed in 1989 with the goal of reducing subjective distress and strengthening adaptive cognitions related to a traumatic event. EMDR is defined as a quick interactive psychotherapy technique found to be highly effective in treating trauma-related disorders such as PTSD, anxiety, and depression. An advantage in using EMDR approach is that this technique minimizes the potential of re-traumatizing the individual since EMDR does not require the individual to describe the past traumatic event. EMDR uses the natural function of the body through rapid eye movements, which causes parasympathetic activation, resulting in physiologic calming and relaxation. EMDR therapy is an 8-phase treatment approach using standardized protocols and procedures. Phases include history, preparation, assessment, desensitization, installation, body scan, closure, and reassessment. Is FEP, first episode psychosis. Psychosis does not discriminate, and 100,000 adolescents and young adults between 15 and 25 years of age are primarily affected annually by first episode psychosis. FEP is a critical interventional period in individuals diagnosed with schizophrenia. Individuals who have experienced a trauma-related event has a higher probability of developing first episode psychosis, and 3 out of 100 people will experience psychosis in their lifetime. Individuals will likely have a co-occurring disorder. While there has been preliminary research conducted to support the safe and effective use of EMDR therapy in individuals with trauma-related disorders like PTSD, anxiety, and depression, it remains unclear whether EMDR can be equally as effective, and no clinical practice guidelines has yet to be established in reducing psychotic symptoms in individuals with early stages of psychosis. Therefore, there remains a knowledge gap in research for EMDR therapy in individuals with early or first episode psychosis. Early detection and treatment of individuals at risk for developing psychotic symptoms is key to reducing the long-term adverse impact of mental disorders and preventing relapses, improving social functioning, and behavioral problems. Recognizing the need for early detection and treatment of psychosis, the National Institute of Mental Health launched a high-quality research initiative in 2008 known as Recovery After an Initial Schizophrenia Episode, commonly referred to as RAISE. As a result, early interventions in psychosis programs were established to promote shared decision-making using psychotherapy such as CBT, medical management, family education, case management, and provided work or education support to individuals experiencing first episode psychosis. Implementation of EMDR as an adjunct to CBT and medical management can be a valuable tool in reducing psychotic symptoms and decrease long-term adverse effects of mental disorders. We will look at 2 studies that support use of EMDR therapy. Study 1 involved 32 patients at a rehabilitation clinic diagnosed with mild to moderate depression. The study group consisted of 16 patients who received EMDR therapy and standardized treatment or treatment as usual. The remaining 16 received the treatment as usual. This was the control group. The treatment as usual consists of psychotherapy, medical management with antidepressants, psychoeducation, and individual and group sessions that provide strategies in coping with depression. The EMDR group received individual sessions that lasted 60 minutes and received treatment as usual. The post-treatment, 68% or 11 of the 16 who received EMDR therapy showed full remission at the end of treatment, as measured by the Symptom Checklist 90 Items Revised Version Depression Subscale. 1-year follow-up, the EMDR group continues to report a decrease of symptoms and relapse related to depression in comparison to the control group who had received standardized treatment. The scale, the adjusted mean SEL90 revised depression subscale scores for those individuals with treatment as usual and EMDR plus the treatment as usual at the end of the treatment. Again, showed that there was a improvement in that group that received EMDR therapy. This is a comparison as well of the depression subscale at the end of the treatment between those two treatment groups. The second study was a randomized controlled trial with 45 patients diagnosed with acute schizophrenia. They were divided into three groups divided equally. The first group was treated with EMDR therapy. The second group received PMR or progressive muscle relaxation therapy. And the third group received treatment as usual. The groups were evaluated objectively using the PANSS or Positive and Negative Syndrome Scale, the Hamilton Depression Rating Scale, and the Hamilton Anxiety Rating Scale. Overall, results showed the effect size for negative symptoms were longer for the group receiving EMDR therapy, and the variance analysis ANOVA revealed significant improvement in each group. Recommendations for implementation. The meta-analytic and narrative reviews of randomized and quasi-experimental treatment studies concluded early intervention services for psychosis can improve symptoms and restore adaptive functioning. Integrating a clinical staging framework and coordinating care through use of early interventional programs and services nationally can detect and provide early detention in treating first episode psychosis. The CHRP assessments by trained specialists can also identify individuals who are potential risks for developing psychosis and initiate EMDR therapy to reduce symptoms and improve outcome. The implications for practice. The EMDR therapy was shown to be effective as an adjunct to CBT and pharmacotherapy. EDMR is well structured and a positive approach in early intervention for first episode psychosis, and EMDR was shown to be effective in the treatment of PTSD, anxiety, and depression, and effective in reducing psychotic symptoms and preventing relapse.